overall, there are two parts to this session. The first is going to talk about little bit about service delivery in general for the CHO and roles and responsibilities. And then we will talk in more detail about putting this in palliative care. Okay. So I'm just going to, I hope I am able to share. Yeah, my screen. That's good. I'm going to share my screen. So please let me know if you can see the screen that I have. I want to show a couple of slides from the screen from the first part. And if you can see it, just let me know, put your hands up. You know the hand up sign, no? You can put the hand up sign and I know that you can see my screen. I'm going to talk only 10%. You all have to talk in 90%, okay, today. So thank you. I can see that Pinky can see it. I'm assuming nobody else can see the screen. Use your hands, sing the hand thing. Rohit Sharma ji, Naresh Kumar, Ramchandra, Jat, Ripu, Sonali. सिर्फ 3 लोग देख सकते, दूसरा लोग नहीं देख सकते. I'm not going to continue
मैम
till I see some
मैम
videos on.
सीन स्क्रीन मैम दिख रही है.
दिख रहे हैं? Okay. Okay, thank you. All right, so I want videos on. Thank you. Okay, so yahan, if you can see, there are 3 boxes. So when we talk about service delivery, or we talk about anything to do with the community health officer, primary health care, there are 3 areas. The first box is at the village level, in the community, in the family level. Okay, and usually for any package, we will talk about how many packages you can tell me later, but for any package, this is done in the community, in the village level. The population is listed out. So here it will be palliative care. How many people who require palliative care in that village? Then screening is done for these people. Okay, screening, and if they need first aid, you would have heard about psychosocial first aid and others. Then, if in case that patient requires referral, then we do referral. Finally, there's some health awareness or health promotion and follow up when they come back. In case you referred them somewhere, then when they come back, we need to do some follow up. Okay, so this is the first level. Some of them have to go to the second level, which is at the sub center where the CHO is sitting, or maybe even to the PHC. This is the health and wellness center, the Ayushman center. Over here, what will happen? They will get some treatment. Then if they find complications, this person may not be able to treat, they will refer higher. The CHO can do telecounseling. With whom? Who will she do telecounseling with?
मैम लोकल हब पे और पीजीआई दोनों पे मेडिकल ऑफिसर्स.
Yeah, okay. So usually PHC medical officers के साथ, नहीं तो CHC के ऊपर या district hospital level. Okay, so at different levels they have telecounseling. Sometimes if it is very specialized palliative care, then only where the palliative care specialists are, they will do. Counseling. Okay, it's important that they have to counsel the family, counsel the parents, the patient also. And if they have to give any drugs, simple drugs, at the sub-center and the PHC level, they can give these drugs. Now, those who are further referred up have to go to the referral level. And this is at the CHC level or the district level, much higher. Okay. And here the specialist will see them. The specialist may have to diagnose and manage some complications. So you must understand this first. What is missing in this diagram? Who can tell me? What is missing? You can see there's one, it starts and it goes to the next level and then it goes to the next level. What is missing according to anybody? Come on. If I had chocolates, I would give it, but I'm too far away. Who can think and tell me? Simple answer. So If it is called continuum of care, it is going up to here and it is stopping now. So the missing arrow is the circle that will come from here back to the community level. Okay. So the patient goes or finishes all this and then it comes back, and over here, the follow up part is done. So this is something you must understand for anything, whether it is an NCD, whether it is tuberculosis, whether it is a pregnant woman, whether it is a baby with some problem, and definitely whether it is palliative care for a person. Okay. Now, just to remind you, where can you see palliative care? What is the package number for palliative care in this group?
11th.
Very good. Okay. So if you see on the left side, these were packages that were already there for more than 30 years. We were doing recently means now it's also not recent. From 2017, they even started NCDs. But these on the pink side, from 8 to 12 are the new packages. So a CHO is supposed to do all these packages, something and something. So today you all are concentrating on package number 11, which is palliative care. And there is a big overlap. A lot of the older people need palliative care because they have the problems also, but it is not restricted to only the old people. Even young children or younger people who have strokes or who have cancer will need palliative care. Okay. So if you have understood up to here, I want to now show you what we call the roles and responsibilities. Okay. Because only if we know the roles and responsibilities of the CHO, then only we can understand in palliative care what all she has to do. Is it clear so far? Are you able to understand, or am I going too fast?
No, ma'am.
Thank you very much. Okay. So you are going to be training CHOs. So you know we have understood why we need CHOs and how it will help. The reason it will help are these main reasons. Okay. First, the person from the village doesn't have to go really far away. They can close by, they can get some care, at least basic care. Okay. It will reduce the out of pocket expenditure. That means apne aap private pockets jeb se they will not have to spend. Then they can use a lot of these services that are available. There are so many services, sometimes we don't know. New programs are starting all the time, and it will reduce the load on the secondary level. Why should a specialist see one cough and cold? Why should a specialist spend their time uh, treating one simple wound? Okay. So these are the important reasons why we have. Now, this diagram you must learn by heart. A CHO has only three functions. The first function is clinical. Okay. That means looking after the patient. We will go through that. The second function is public health, because the CHO is looking after a sub-center area or health and wellness center that usually covers 4 to 5 villages, 5,000 population. So whatever she must do must be for all the community members in that. Okay. And the third is she's or he is a manager. Okay. They have to manage their center, they have to manage their team. So let's look at each of these and understand what it means for each. Okay. So look at clinical. The clinical has 5 points. Okay. The first one is early detection and screening and first level management. Now, in palliative care, if you look at it, early detection of someone who needs, okay, you have a person who has a stroke, or you have a person who has cancer, who's bed bound, then we have to quickly detect, are they getting an infection, pneumonia, skin bed sore, or some other problem? Quickly detect it, screen, and give the treatment immediately so that it doesn't get complicated. Okay. Sometimes they get urinary infections also. Okay. Second is, if you can't treat, don't send them back home. Refer them to another place where they can get treatment. Okay. Then very important, they're going to get the treatment and they're going to come back. So you have to do follow up. So these three go one after the other. You detect and treat. You can't treat, you refer. After refer, they come back, you follow up. Then you also give counseling, especially for palliative care, which is chronic. It is not like a fever and cold, 3 days and they are fine and they forget about it. It's chronic, continuous care. It's not only counseling that patient about the disease, about the problem, but here also the caregivers, the family members, or whoever's looking after. And you can do teleconsultation because it's very difficult for all the patients to keep going to the district level hospitals. So through now they all have tablets, they all have laptops, so they can use telecounseling and teleconsultation to find out what to do. So these 5 points come under clinical. I'm going to take a test on the end. Now we're going to look at public health. In public health, first they must collect the information from that village. Who are these patients who need palliative care? Not everybody. But even if there are 3 people, I must know who those 3 people are. I cannot say Asha knows or A&M knows. No, it's my job as CHO to understand what is happening in my area. And for these 3 people or 20 people, if in my area, what am I going to do? Okay, for them, what services are going to provide? Then community level action. How can I do health education to the community so that they can prevent problems, so they don't get into situations where they need palliative care? How can I do health education of the community as to how to help and support a family who needs? Okay. And the third one is disease surveillance. So even these patients can get dengue, they can get diarrhea, they can get other problems. And these are what we call notifiable diseases. Okay. So I have to keep a check. Suppose suddenly there is one disease of, a diarrhea outbreak, then I cannot say, oh, that family is not going to get it. Why? Anyone can get it. So I have to keep a surveillance and keep reporting and keep checking. So that's my public health. There are 3. And let's go to the managerial. You also know as doctors, none of us were trained to become managers in our MBBS curriculum. Correct? We learnt it only when we started working. Here, the CHOs also, they're nurses or Ayush practitioners, they don't learn it in their curriculum when they're doing undergraduate. But they do so much work. The first biggest managerial work is recording and reporting. Have you ever seen the number of reports they have to make? Online reports, physical registers, all the time they have to check. They have to not only make their own reports, they have to check the reports of their team, the A&M's reports, the ASHA diaries. Then the second thing they have to do is looking at administrative function. The stock management, the finance management, the HR management of their team, the making sure that the drug inventory is kept. So all these things are happening at the managerial level. And finally, supportive supervision of the team. Okay, so we say a good leader and will always supervise the team being as a supporter, not as a policeman monitoring and saying you didn't do this or why you didn't do this, but how can you do it better? Okay, so these are the main roles and functions of a CHO. Okay, later on I will ask you we can do it only for palliative care. Okay, so if you've understood to here, I'm going to the next slide. She's not alone. There's a team that this CHO works with. Who are these people on the team? Anita Kumari, can you list out the people that are over here in this slide that you can see in the team? Anita? You can unmute and tell me. रघुवीर, आप बता सकते कि कौन है ये टीम में यहाँ पे स्लाइड पे? All have taken vow of silence, I think, today. रामचंद्र जाग, आप बताइए. Who's going to help me now? Come on. हाँ, बताइए.
MPW.
Okay, so Asha and MPWs. एक CHO के साथ कितना MPWs है?
1 मैम.
मैम 2 फीमेल MPHW है, एक NHM एक रेगुलर
हाँ,
और एक एमपीएसडब्ल्यू
और एक
मेल।
मेल वर्कर।
होना चाहिए, लेकिन रियलिटी में तो एक या दो ही हो रहे हैं। ओके, एक फीमेल एक मेल। और आशा कितना लोग अंदाज में?
मैम 1 per
5,000
1000
होते हैं।
पॉपुलेशन।
वेरी गुड। सो अंदाज में कितना एक हेल्थ एंड वेलनेस सेंटर की?
मैम 4, अराउंड अबाउट 4।
मैम
Four या
5000
five?
पे हेल्थ वेलनेस
5
सेंटर
आशास में।
7 भी है, 9 भी
5
है।
आशास। हाँ, तो 5। ओके, सो दीज आर द इमीडिएट टीम मेंबर्स। ओके, लेकिन उनके साथ और लोग भी हैं कि पीएचसी में भी लोग हैं, क्योंकि वो उनके साथ टेली कंसल्टेशन कर सकते हैं, रेफरल कर सकते हैं। तो वहाँ भी डॉक्टर, स्टाफ नर्स, लैब टेक्नीशियन, फार्मासिस्ट सब लोग हैं वहाँ पे। और ऊपर जाएगा तो ब्लॉक लेवल। ओके, क्योंकि पूरा एडमिनिस्ट्रेशन का जरूरत, स्टॉक चाहिए, इंडेंट्स भेजना, रिपोर्ट भेजना। कहाँ भेजते हैं? यहाँ पे। ओके, ब्लॉक मेडिकल ऑफिसर इंचार्ज, वो सबसे जिम्मेदारी उन ब्लॉक मेडिकल ऑफिसर लेते हैं। और सेकेंडरी लेवल, क्योंकि कई केसेस वो रिफर करते हैं डायरेक्ट सीएचसी या डीएच, कॉम्प्लिकेटेड का केसेस। तो उन वहाँ पे डॉक्टर्स और नर्सेस के साथ उनका टीम है। तो आप उनको बता सकते कि बताना चाहिए कि सीएचओ अकेले नहीं है। ओके, उनके साथ इतना लोग हैं और उनके साथ सब मिलकर टीम वर्क करना चाहिए काम चालू होने के लिए। एंड पैलिएटिव केयर मींस इवन मोर इम्पोर्टेंट। ओके, okay, so I just wanted to show you this is inside the sub center, but outside the sub center also you can see how many people are involved. Okay, now this I'm going to share this, and I'm going to ask Pallium India to send you this PPT to understand. CHO must also know what is Asha's work, what is MPW's work. Otherwise everyone will be duplicating, or they will say this is not my job, it is her job. She will say no, that's not my job, it is your job. And then they will be just passing it like that, and nobody will do. So CHO must know, as the leader of the team, she must know what is there. She must also know what PHC medical officer can do, what they cannot do, what the block medical officer is going to do. So these are important role slides for you to understand. I'm not going to spend too much time, but it's important for you to know. Also, we tell the CHO, you make one weekly plan. Okay, some days you're sitting in the OPD. Now you can show me, if you can see this slide, which day she is not sitting in the OPD. Which day in the morning time you can see, no, OPD. So Monday she's sitting in the OPD. Which day she's not sitting in the OPD in this slide? Who can tell?
मैम वैसे तो हमारी ड्यूटी
फ्राइडे।
फ्राइडे। हाँ, बताइए।
फ्राइडे आउटरीच सेशन।
हाँ, कौन बताया हमारा ड्यूटी के बारे में?
मैम डॉक्टर अनु फ्रॉम HWC खुर्दी हरियाणा से मैम,
हाँ,
यमुनानगर से।
बताइए। हाँ, बताइए।
मैम वैसे तो हमारी ड्यूटी जो है वो सारे फुल डे 6 डेज ही है, बट लेकिन हमारी ड्यूटी सर मैम जैसे कई बार CSC पर भी लग जाती है, तो उन दिनों में हम लोग होते नहीं है यहाँ पे
करेक्ट।
सेंटर
तो
पर।
अगर आप ओपीडी में नए हैं तो क्या करना वो दिन? अगर पेशेंट आएगा तो क्या करना? बंद नहीं कर सकते नहीं?
लेकिन मैम जब
कौन
वहां पे
बैठना
तो
वहां पे?
आशा वर्क मैम ANM या
एएनएम।
MPHW या
हाँ,
फीमेल ही है।
हाँ। तो आपकी जिम्मेदारी है कि वो बताना कि एएनएम आप बैठे आज दिन, आप ट्रीट नहीं कर सकते, लेकिन आप थोड़ा देख सकते कि कोई इमरजेंसी केस आया तो या नहीं। एंड देन सो कोई भी रहे ना वहां पे, आप सीएचसी जाएगा तो दूसरा चीज, लेकिन यहाँ पे आप फील्ड को भी जाना चाहिए, VHND को देखने या पार्टिसिपेट करना। या तो अगर आप ओपीडी में नहीं हैं तो कोई दूसरा लोग होना चाहिए उसमें।
ओके
एंड
मैम।
सो ये थोड़ा आप टीम के साथ ये ऐसा वाला टाइम टेबल बनाया तो चालू से इफिशिएंट से काम हो चल सकते हैं। ओके, तो उसके लिए ये बहुत जरूरत है। ये थोड़ा सिर्फ इंडिकेशन एग्जांपल, लेकिन आपके एरिया में अलग हो सकते हैं। लेकिन ओपीडी का काम सिर्फ ओपीडी काम नहीं है, ओपीडी का काम। ओके, ओपीडी तो चालू है सुबह के टाइम, कब पेशेंट्स आते हैं आप अभी आपको मालूम है कि वो कितना टाइम आते हैं, कब कब दिन आते हैं। दूसरा दिन आप फील्ड को जा सकते हैं, एक दिन तो सीएचसी को जाना, मीटिंग को जाना, दूसरा चीज। तो टीम मेंबर्स को आपके साथ रहना और वो थोड़ा ओपीडी में बैठ सकते हैं। ओके, नाउ who's going to give? I'm going to call out some names. Some people are not opening their mouth, some are very very useful. Good. Anu. Anu Boundwal.
बेनीवाल, हाँ जी मैम।
बेनीवाल, हाँ, ओके ओके। आप पहले वाला आंसर दीजिए। CHO, द मोस्ट इम्पोर्टेंट एडिशन टू प्राइमरी हेल्थ केयर टीम।
एट हेल्थ वेलनेस सेंटर मैम।
Very good, very good. Okay, okay. Now, Anita Kumari. By giving these services close to the community, what are we reducing? Anita? Sandhya Thakur? Sandhya? Reducing क्या? क्या कम होते हैं? CHO अगर अच्छा काम करेगा फील्ड में? Anybody?
Out of pocket expenditure, ma'am.
Very good. Who is that? I can't see
It,
the.
it also
Service, ma'am.
it also reduces mortality and morbidity.
Okay. But here we are
Burden,
mainly reducing.
ma'am, burden at secondary and tertiary care.
Oh my goodness, y'all are reading very carefully. Good. So it reduces all those problems. Burden for tertiary care, reduces the mortality, and for the people, it reduces the out-of-pocket expenditure. Okay, 3 functions of the CHO. What are those 3 big circles? Anyone can tell me? First
Ma'am,
one is
clinical,
मैम
clinical,
क्लिनिकल,
second one
and managerial.
public health, and third one
Managerial.
very good. Okay. So I'm not going to do any others because you're answering very well. But you can I'll share this presentation with you all. But this is a revision. Okay. Now you have understood general role, CHO का general role. आप सब लोगों को induction training भी खत्म हुआ है. So now we're going to look at in palliative care. Okay. What are the things we have to see? What is the service delivery that the person must see in palliative care? Who can tell me what is palliative care? क्या है ये palliative care? थोड़ा example दीजिए. कौन palliative care is what care? Is it acute care, chronic care? किसके लिए?
Palliative care is the care given for chronic conditions and for those conditions for those diseases which are terminally ill patients or like cancer.
Okay.
And
All right. Anybody wants to add anything?
मैम इसमें
Ma'am,
that improves
one by
क्वालिटी
one. Very good.
क्वालिटी ऑफ लाइफ दे सके, इसमें हम सपोर्ट करते हैं पेशेंट को और उसके रिलेटिव्स को.
Okay. Anyone else? Pradeep? Yeah.
मैम
एक मिनट. Pradeep first, then Sunil Mehta. बताइए
yes, I'm
Pradeep.
saying that improves the quality of life of patients.
Okay. Very good. Yes, Sunil.
Yes, ma'am. It starts at the time of diagnosis.
Excellent. Okay. So palliative care, you have seen that diagram, no? Have you seen that diagram in palliative care? That graph, it does not start with end of life. Okay. It starts at the time when early detection, the minute you diagnose, you're beginning palliative care from there. From then onwards, you are trying to look at the quality of life. And some cases, unfortunately, don't improve. They do end up dying. So you will continue your care. Does it end with death? Now, when the
No,
patient
ma'am.
dies, then when does it end?
मैम रिलेटिव्स को सपोर्ट करने में रहता है उसमें.
Yes. Okay. So after death, भी relatives को support करना थोड़ा time 6 months तक हम बोलते हैं. See, so palliative care is a long-term care, not only for cancer patients, not only for dying patients, for anybody. One child with kidney disease means dialysis patient, kidney patient, they also need palliative care. Somebody had a stroke, palliative care. Someone had accident with multiple fractures and they take 6 months, 8 months, 9 months to recover. They need palliative care. Okay. So it's very important for us to know and understand that. Therefore, we will then know how to deliver the services as a healthcare provider. Okay. So now I will just share the actual presentation for today was about this, about service delivery. Okay. So what are we going to learn in this session? Mainly, we're going to look at what are the palliative care services at the community level. Community means in the field, at the sub-center where the CHO is sitting, and referral center. And what is the CHO's job? for this. Okay. And how they have to coordinate with field at the bottom and doctors and medical officers and CHC people at the top. Okay. So now at the community level, CHO is not sitting there in the village. Who is sitting in the village?
आशा वर्कर.
Asha. And who is visiting the village regularly? ANM. Okay. MP, now we call them MPW. So what is their job for palliative care? So the first job is to create awareness. Okay. What is palliative care? So when they attend the VHND, there'll be a committee VHSNC meeting, or when they're having with this community, they'll explain this is what palliative care means. This is how what you can do. This is what we together can do. Who can read the second point?
Home care
Home
visit
care
Visits as a good. Continue.
as part of home care team, Asha will coordinate.
Okay. So we say that at least once a month for not serious cases, or more often weekly to thing for other cases, and the Asha will coordinate. But the home care visit is done in the house. The home care team we will talk about little later. Okay. गुरतेज जी अब सिंह आप बता रहे तीसरा पॉइंट क्या है? गुरतेज थोड़ा पढ़ लीजिए ये. पंकज सिंह. नरेश. Piyush.
Yes, ma'am.
Thank you. Third point, can you read?
Equip caregivers in simple nursing tasks.
Okay. So we can teach the family members, okay, how to clean, how to bathe, how to, clean the eyes if it's a simple wound, small little nursing tasks, how to feed somebody who's, bed bound, and, just basic sponge bath and those kind of things we can teach. Prerna, can you read the fourth point? Prerna? Why is nobody answering? What's happened? Manisha, Dr. Manisha? Okay, let me go back to the ones who are all the time answering. Dr. Sunita?
Yes, ma'am.
Fourth point, can you read?
Notify and refer those needing more care to CHO.
Yeah, so Asha and MPW will refer to the CHO in case they need. Continue with the next point. Non-pharmacological
Non-pharmacological.
management of symptoms.
So that's very important because just sorry, no, non-pharmacological means not the drugs. Okay, what other things we'll do, whether it's nutrition, whether it is counseling, whether it is physiotherapy. Okay, those are nothing to do with drugs. Then the last two is provide psychological and spiritual support, and finally end of life. So this is done at the community level. Okay, Meenakshi, I want you to read now what is done at the CHO level. Okay, and even in the community level, some are given to the ASHA, some are given to the ANM. Okay, the more of the nursing work and all is done by the ANM. More of the identification and referring and all that is done by the ASHA. Now let's look at the CHO. Remember those three functions, no? Clinical functions. Okay, so Meenakshi, can you read the clinical functions for the CHO?
Yes, ma'am.
Yeah.
Conduct detailed assessment of patients during palliative care.
Yeah, if you'll have your books, it will be in Annexure 1. Okay, so first, how will we assess? There's a form that we have to fill and find out exactly. Yeah. What's the next point? Continue, Meenakshi, all the points on this.
Refer patient to higher centers for palliative care when needed.
Yeah, Okay.
decide basic nursing care to palliative patients and perform necessary. Ma'am, actually, slide is little bit cut from the left side, so
Oh, okay. The
full
nursing
version
procedures in required
in
cases.
required cases.
And finally,
Provide home care as the part of home care services.
CHO also is part of the home care team. Remember that. Okay. So remember early diagnosis and treatment, referral if you cannot treat, follow up, counseling, and teleconsultation was the clinical functions. Here you can see assessment is part of early diagnosis, referral. Okay. Nursing care is also part of treatment, early diagnosis and treatment. Home care is also part of that. So these are clinical functions. Let's look at the public health functions. Who's going to read the public health functions for me? Who will volunteer?
Ma'am,
Yeah, go ahead.
good evening, ma'am.
Good
Public health
evening.
functions take leadership in creating patient support groups and caregivers support groups with community volunteers.
Very
Second one is
important.
conduct IEC.
Yes.
Yes, ma'am.
Continue.
Yeah, IEC and SBCC. What does it mean, ma'am? SBCC?
So support behavior communication activities. Okay.
Okay. Regarding
Then,
palliative care, the area and to recruit community volunteers.
okay.
And third one is help patients or families avail benefits from various government and non-government programs or schemes.
Very good. So I'm sure one of y'all, all of you all may have had some relative or a friend's relative who is having problems like this and needs palliative care. So it is the patient who suffers and also the caregiver, because every day from morning to night, that caregiver has to look after the patient, look after the person who needs, and they have to look after themselves. Sometimes we say they can burn out because day in, day out, it's not easy. So usually, if we can form a support group, then they know that they're not alone. There's somebody else also like them. Then they can share, they can counsel each other, support each other. So that's really useful and helpful. The second is, if the family can't manage, it's important for the CHO to see are there other people in the village. Luckily, we are in India, which is a very supportive community. We always like to help someone if we can. Okay. So, who are these volunteers? Maybe something simple. I can't leave the house because I have to look after this person. Can you go and buy my vegetables? Or my medicines I'm supposed to collect, but I cannot go to to the sub center. Can you go? So some little jobs that the volunteers can do. Or I have to go somewhere. Can you stay in the house? And for 1 hour, 2 hours. So can we recruit these community volunteers? Okay. And finally, the government has so many schemes. It can be something simple like a wheelchair or a walking stick, or something like pension, something like special, funds that are available. So the CHO must explain to the family, these are the things available. If your family is eligible, then I can help you to get this. Okay. Now here are the managerial ones. So Devish, can you read out the managerial functions for the CHO for palliative care? Devish, Anu Beniwal,
हाँ जी
you're
मैम
active. आप थोड़ा
Yes.
पढ़ लीजिए managerial functions.
Supervise the SHC at WC team in identifying and line listing of individuals requiring palliative care.
Okay, very simple. This is SHC means Sub Health Center, HWC is Health and Wellness Center. Okay, then
Maintain records of palliative care patients in the area, including referral and follow-up records.
you have seen all the formats for palliative care, or we'll finish that session, I'm sure. Okay, first visit, second visit, home visits, there are many formats. Okay, so these records have to be maintained. Okay, then next one.
Maintain inventory control for the home care kit.
Okay, good. So I'm sure you have heard about the home care kit. The one home care kit is given to every family who needs palliative care. It contains some drugs, it contains some first aid things. I'm sorry, it's not given to that, it's kept to the MPW. Okay. And the MPW is in charge of the home care kit, but when she goes to the house, she takes it with her. But what all is supposed to be kept in it, what has to be replaced, the CHO is responsible. And the last one,
Maintain a list of palliative care hospitals physicians up to district level with contact
Contact.
details
Why we need this list?
for referral, ma'am.
Referral, or you want to do teleconsultation or
To
some
follow up.
Follow up.
also. Yeah, okay, for referral, and if we need to serve any help from them. Okay, so that we found out now up to CHO level. We finished community level, ASHA and MPW. CHO we have finished. Now we're going to referral level. Dr. Sunil, can you read these points, please, for referral? What are the points?
Getting out services at least a week. Inpatient services. Referral of medicine including pain management. Referral to higher center when needed. Provision of home care and end of life care on routine emergency basis whenever needed. Awareness generation activities. Maintain relevant records. Maintain drugs and consumable and inventory control. Monitoring of palliative care activities of health wellness center in the area.
Very good, thank you. So you can see this is at a hospital level, no? CHC or district level hospitals, the bigger hospitals. So they have to have an outpatient once a week. They have to do rounds every day and look at the inpatients, prescribing medicines. If they cannot treat, it's very complicated, then they have to send it to the specialist hospitals, okay? In Haryana, which are those big specialist hospitals? You have many, what are they? Above the district, some medical colleges will have some specialist hospitals. Any special one that you know?
मैम एम्स की ब्रांच है झज्जर में.
Okay, where is it? कहाँ पे?
मैम झज्जर में.
Oh, good. Oh, I didn't know. Very good. So this is at the referral doctor's level. So now you have seen there are three things. Now I'm having a quiz. Okay, now I want all of you to put on your videos because I have not seen half your faces. Let me see some faces, please. Put on videos now. 5 minutes for the quiz. Only those, yeah. Thank you. Come on, such nice, happy faces I can see. Come on. Yes. Put on everybody. So many people are there without video. Come on, put on your videos. Piyush, Anita Kumari is, I don't know where she disappeared. Okay. All right. I'm going to show you a quiz and I'm going to call out a name and only that person should answer. If that person cannot answer, the next, whoever knows the answer must put up their hands. Okay. Don't simply shout. Okay. And Dr. Devesh Kumar, you put down this hand, otherwise I will not know whether you're doing it for the quiz or not. So there's going to be slides. It's going to talk about some activity. You have to tell me which level. Is it in the community level? क्या वो CHO का level में, sub center level या referral level? Okay, 3 levels है ना? Community, sub center, referral. Then second question is, उस level में किसका जिम्मेदारी? Is it आशा या MPW का जिम्मेदारी या CHO का जिम्मेदारी या doctor का जिम्मेदारी? Specialist level. Ready? Okay. Now, first point, Anu. Identification and mapping of palliative cases in the village. Which
Ma'am,
level?
आशा वर्क.
आशा वर्कर. तो किस level पे?
मैम ये कम्युनिटी लेवल.
Very good. Community level. और आपने correct बताया, आशा और उनके साथ भी MPW भी कर सकते. राजेंद्र वर्मा. दूसरा वाला. Risk assessment of the elderly. Palliative या elderly using CBAC form. एक CBAC form
Community level में मारता. Community level.
Very good. My goodness. और कौन करते हैं?
आशा.
Asha. Good. Dr. Sunita. Maintain records of palliative cases in the sub-center. किस level पे ये? Unmute ma? Unmute?
CHO level पे मैम.
Very good. So at sub-center level और CHO ये करते हैं और MPW के help लेते हैं. Okay, इसमें. Okay, next is Sonia. Sonia, comprehensive geriatric assessment for old people with palliative care needs. Some old people need. किस लेवल में ये करते हैं कॉम्प्रिहेंसिव जीरियाट्रिक असेसमेंट? कहाँ पे? कम्युनिटी, सब सेंटर या रेफरल? अनम्यूट कर दीजिए, अनम्यूट कीजिए। हाँ बताए। मालूम नहीं तो गेस कर सकते, नहीं मालूम।
टर्शरी लेवल में।
टर्शरी लेवल। और कौन बताएंगे?
मैम कम्युनिटी लेवल पे।
कम्युनिटी लेवल हम देखेंगे। ये नाइदर टर्शरी नाइदर कम्युनिटी, ये CHO का काम।
CHO।
हाँ CHO का काम, कम्युनिटी जीरियाट्रिक असेसमेंट, क्योंकि आशा नहीं कर सकते हैं और जरूरत नहीं है कि वो पेशेंट वहाँ टर्शरी लेवल पर जाए। ओके, CHO कर सकते हैं। और ये असेसमेंट में हम देखते हैं फिजिकल फुल असेसमेंट देखते हैं, फॉल्स के रिस्क देखते हैं, ऐसे दूसरा क्योंकि पैलिएटिव केयर नीड्स है तो हम देखेंगे। ओके आगे जाएगा लक्ष्मी।
ma'am.
Promote psychosocial first aid through the VHSNC या MAS. MAS is the urban community.
मैम ये कम्युनिटी लेवल पे।
Very good. कम्युनिटी
और
लेवल पर कौन
हाँ
करेंगे
जी
कम्युनिटी लेवल में?
MPHW फीमेल।
मैम कम्युनिटी लेवल पे हमारी जो MPW टीम है
आशा
और आशा दोनों।
वेरी गुड। ओके प्रदीप। ओके educate and
Yes, ma'am.
train caregivers in basic home care skills. कहाँ पे करेंगे ये, किस लेवल पे?
This is a community level.
ओके एंड सब सेंटर लेवल अगर वो आएंगे।
Sub center level.
एंड कौन करेंगे ये?
CHOs,
एंड
MPHW females.
MPW से CHO का जरूरत है ये, क्योंकि ये ट्रेनिंग वाला है तो CHO का जिम्मेदारी। ओके डॉक्टर भारत। Arrange for assistive device. Assistive device means spectacles, walkers, dentures, कुछ चाहिए from higher centers. Arrange कौन करेंगे?
ट्रस्ट लेवल पे होगा मैम, CHC लेवल,
किस लेवल पे?
GH लेवल में, डिस्ट्रिक्ट हॉस्पिटल।
GH लेवल नहीं, अरेंज करने के लिए तो, इंडेंट करने के लिए, अरेंज करने के लिए, लिस्ट भेजने के लिए तो। हाँ सॉरी लक्ष्मी, आई डिडंट सी योर हैंड नाउ, आई सॉ योर हैंड। ओके तो ये सब सेंटर में। ओके हाँ जरूरत नहीं, क्योंकि पेशेंट क्यों जाना डिस्ट्रिक्ट लेवल को, सिर्फ वो बताना कि वो मुझे एक स्पेक्टिकल चाहिए है? तो अगर CHO है तो वो अरेंज कर सकते हैं। Okay, now Lakshmi, since you put up your hand, medical
Yes,
and
ma'am.
surgical treatment of complicated cases.
मैम ये सेकेंडरी एंड टर्शियरी लेवल पे होगा और
Very good.
GH, SDH और मेडिकल कॉलेजेस
And specialists ये काम
जी।
करेंगे। Okay. Oh my goodness, these are very very good group. Vinita. Vinita,
Yes, ma'am.
I can see a beautiful table, but I cannot see your face. Okay.
Okay,
Now, assist the
अब
PHC.
आ रही है क्या मैम मेरी? मुझे समझ नहीं आ रही कि मेरी वीडियो मुझे नहीं दिख रही, तो मुझे समझ नहीं आ रही।
लेकिन मैं सुन सकती तो कोई बात परवाह नहीं। ओके अभी ये बताइए कि असिस्ट द PHC मेडिकल ऑफिसर इन प्रोवाइडिंग मैनेजमेंट फॉर कॉमन या ट्रीटमेंट्स। कौन मेडिकल ऑफिसर को असिस्ट देते हैं?
असिस्ट PHC का स्टाफ ही देगा।
हाँ स्टाफ तो कौन, लैब टेक्नीशियन करेंगे?
इमरजेंसी
अगर कुछ ट्रीटमेंट करेंगे ना तो कौन असिस्ट करेंगे? PHC में कौन?
ऑफिसर्स करेंगे।
स्पेशलिस्ट मैम।
स्पेशलिस्ट नहीं, PHC में।
नर्सिंग ऑफिसर।
हाँ स्टाफ नर्स हम बोलते हैं।
स्टाफ नर्स, नर्सिंग ऑफिसर।
PHC में स्टाफ नर्स। ओके वेरी गुड। ओके ओके अभी कौन? सुनील जी। Establish linkages with NGOs for palliative care services and health promotion. तो हम लिंक करना चाहिए दूसरा सेंटर्स के साथ। कौन करेंगे और कहाँ पे?
HWC पे मैम, NGO।
वेरी गुड। ओके और कौन करेंगे? CHO। CHO ये लिंकेजेस हम वो। ओके किस फंक्शन में आएगा यार? ये क्लिनिकल का फंक्शन है या पब्लिक हेल्थ का फंक्शन है या ये मैनेजरियल का फंक्शन?
Managerial.
Very good, very
Public health
good.
में.
Got 100 marks for you. Okay, मैनेजरियल का फंक्शन ये. Okay, और अभी राजेंद्र वर्मा, supportive supervision of MPW and ASHA, supportive supervision of ASHA और
Community level
MPW
CHO मैम.
in care. क्या बोल रहे बताया?
Community level CHO.
CHO करेंगे लेकिन वो सब
Yes.
सेंटर लेवल में.
Sub
Okay,
center level.
Sub center.
लेवल. Okay, so good. अभी मैं 2-3 स्लाइड्स बताएंगे कि ये रेफरल पाथवे बहुत कॉम्प्लिकेटेड स्लाइड है, लेकिन आप देख सकते हैं कि तो हम यहाँ से शुरू करते हैं कम्युनिटी से. ओके, तो कम्युनिटी आइडेंटिफिकेशन करना आशा एमपीडब्ल्यू वॉलंटियर्स है. स्क्रीनिंग करते हैं. स्क्रीनिंग के बाद 2 चीज हो सकते हैं. वो घर में ही होम बेस्ड केयर ले सकते हैं, वो नहीं चालू है तो पीएचसी अगर रेफर करना तो पीएचसी को भेज सकते हैं, वो वीकली वंस आउट पेशेंट के लिए. ओके, होम केयर बेस्ड केयर तो चालू है, ठीक है, तो और कुछ नहीं है, तो सिर्फ वो फॉलो अप करेंगे. अगर ये भी नहीं हो सकते तो वो रेफर करेंगे सेकेंडरी लेवल पे, सीएचसी या उसके ऊपर. वहां भी नहीं होगा तो टर्शरी लेवल पर जाएंगे. और अब भी देख लीजिए कि वापस है ये एरो वापस जा रहे. ये तो हमारा फॉलो अप का फील्ड. तो बहुत इम्पोर्टेंट है कि अपवर्ड रेफरल करेंगे तो डाउनवर्ड रेफरल भी होना चाहिए. वापस आएंगे डाउनवर्ड रेफरल ऊपर से वापस फील्ड में. ओके, ओनली देन हम बता सकते हैं कि ये कंटिन्यूम ऑफ केयर. कंटिन्यूम ऑफ केयर मीन्स वन सर्कल की जैसे. ओके, हम शुरू किया यहाँ से, पूरा राउंड जाके वापस यहाँ पे आए. ओके, सो दिस इज द रेफरल पाथवे फॉर पैलिएटिव केयर. यहाँ आपका बुक्स में है. ओके, फाइनल टेस्ट. मोहम्मद इम्तियाज. इम्तियाज जी, आपने कुछ नहीं बताया अभी टेस्ट में बताए. हेलो, अनम्यूट कर दीजिए मोहम्मद. पिंकी शर्मा.
Yes, ma'am.
Okay, come on. First question is for you. All these are CHO का roles except, इसमें सब CHO का जिम्मेदारी, लेकिन एक नहीं. किस वाला? वो नहीं करेंगे, दूसरा उनका टीम में दूसरा करेंगे. Which one?
Providing home care for palliative care patient.
Anybody else wants to answer? ठीक है या नहीं? वो ठीक है क्या?
मैम सी है, मेंटेनिंग लिस्ट ऑफ पैलेटिव. सॉरी.
Ma'am C. Correct answer C.
पैलेटिव
नहीं, बी ठीक है मैम, जो दी आंसर.
B and C आपने बताया.
बी आंसर ठीक है.
B या C. ओके, हम बाद में आंसर देखेंगे. थोड़ा भारत भूषण. अभी दूसरा वाला, ऑल आर रोल्स ऑफ स्टाफ नर्स. स्टाफ नर्स कहाँ है? पीएचसी में. ओके, लक्ष्मी वांट्स टू आंसर. एक्सेप्ट, ये पूरा करेंगे लेकिन एक वो नहीं करेंगे. ओके
Ma'am,
लक्ष्मी.
supportive supervision of ASHA and MPW.
वेरी गुड, वेरी गुड. ओके, सो पहले आंसर इज डी. तो CHO will refer. CHO is part of home care team. CHO वही कनेक्शन करेंगे ना, लिंक करेंगे दूसरा पैलिएटिव हॉस्पिटल्स के साथ. लेकिन वो कम्युनिटी वॉलंटियर्स को नहीं कौन करेंगे? आइडेंटिफाई कम्युनिटी वॉलंटियर्स कौन करेंगे गांव में?
ASHAs, ma'am.
ASHAs. Okay, so you understood. Okay, this is also very good. Okay, now Sunil, ASHA or MPW will prepare a list of different kinds of people, elderly people. क्या क्या आपको समझ में है? You may have studied it. We divide this group into 3 groups. One is bed bound. You may not have learned this. Okay, that means वो पूरा दिन बेड ही में है, बाहर नहीं आ सकते. Restricted means वो wheelchair में बैठ सकते हैं और mobility तो थोड़ा restrict है. Mobile means कुछ तकलीफ नहीं है mobility में. Okay, sorry, that answer you may not have known. Okay, Anu. Managerial function of CHO is to provide basic nursing care to palliative. True or false? Managerial function में nursing care देना. True or या false?
मैम ट्रू।
True. सब लोग मानते हैं कि ये true है?
No,
False,
ma'am,
ma'am.
false है.
ये तो
False.
false
clinical
है मैम,
function
false है,
हाँ,
false है।
ये किस
वो
function?
फॉल्स
ये
है मैम,
किस
मैनेजियल में रेफर।
Clinical में आता
function
है.
में आएगा ये।
clinical function? Very good. सुधीर सिंह है वहां पे, यहाँ पे?
Yes, madam.
Okay, very good. Okay. Home care provided to patients and families requiring palliative care, sir, is done to ensure continuum of care. True or false?
True, madam.
Very good.
True.
होम केयर हम देते हैं क्योंकि हम पूरा सर्कल को करना चाहिए. Okay. और Meenakshi,
Yes, ma'am.
okay. Asha will help the CHO in undertaking assessment of elderly and palliative and maintaining the records. Asha will help. True or false?
False, ma'am.
Who will help you, Meenakshi? CHO
Ma'am,
को कौन मदद देंगे? हाँ?
True, ma'am, true.
ANM.
नहीं मीनाक्षी बताए, अगर आशा ने करेंगे तो कौन करेंगे? कौन असिस्ट कर सकते हैं CHO को? और कौन है उनका टीम?
MPHWs, ma'am.
Ma'am, MPHW, ANMs.
वेरी गुड. ओके, सो MPW ये काम करते हैं. तो ये हमारा सेशन थे एंड आई एम वेरी हैप्पी. ओके, नाउ आप कुछ डाउट्स है या क्वेश्चंस है, प्लीज. एनी डाउट्स? Oh, lots of people were answering.
No, ma'am.
No doubts. Did you understand? Do you remember? Okay. So there are 12 packages.
Yes, ma'am.
12 packages. Community, CHO level is a sub-center, and third level is referral. Okay. And from referral, we do follow up and come back. Okay. Then function of CHOs is 3. What are the 3 functions? First one is
Clinical.
clinical, and clinical has 5 parts, remember. Second one is
Public health.
public health, mainly for health promotion, disease surveillance, okay, making the lists. Third one is managerial. Big headache, but very important. नहीं escape कर सकते ये managerial का function. Okay. And out of these functions in palliative care, उनके साथ भी एक टीम है, आशा और MPW है गांव में, कम्युनिटी में. और ये टीम भी आते हैं सब सेंटर के पास. एंड रेफरल लेवल इज CHC या ऊपर. ओके, एनी क्वेश्चंस? Palliative care is very, very difficult, but one of the most important part of helping person who's sick. And the satisfaction you can get to when you help and they say thank you, nobody can replace it. It is so important. You know, in your own families, everybody will have someone old, someone who's been sick. If not in your own family, at least in, you know, some friends or something else. So very important for you to understand and for you to do it. For this, you don't need so much technical knowledge. You need a good heart. Okay. And you have to be patient. You have to be kind. You have to be repeating and going back and helping. You treat something, again next month they come back with the same problem. Cannot shout at them because they are also struggling. So you have to learn how continuously it goes, and it continues even after death. So it's really important as CHOs for you to understand कितना important आपका role है यहाँ पे. Okay. Okay, if there are no questions, what is the next steps? I don't know. So you'll have to tell me here.
So ma'am, this is the last session. So I would like to hear some of the feedbacks from the spokes as well. So
yeah, go ahead and ask. Yeah, I will listen.
Yeah. So is there any like someone like to share something like since this is the last session? So anyone?
मैम सेशन बहुत अच्छे रहे सारे ही, बहुत कुछ हम लोगों ने मतलब नया सीखा और वो था, लेकिन बीच में भी हम लोगों ने बोला था कि अगर इसके साथ हमें हैंड्स ऑन ट्रेनिंग थोड़ा क्लिनिकली पार्ट जैसे जो कराया था उसकी दी जाए तो मोर बेनिफिशियल होगा।
Yeah, we will look into that soon. Yeah, we will.
ओके मैम।
Any other feedbacks?
Yes, ma'am. Thank you so much for these wonderful sessions. Our knowledge from zero in palliative care increases to very high. And in addition to it, I would like to thank ECO team, Palladium India team for organizing such wonderful sessions. Thanks, ma'am.
Yeah, thank you, Dr. Suresh.
अगर आप चांस मिलेगा तो जरूर आप केरला को जाना और पैलियम इंडिया की को विजिट करना, क्योंकि बात से उतना नहीं मिल सकती, लेकिन वहाँ विजिट करने के बाद आप पूरा दिमाग चेंज हो जाएगा और केरला भी देख सकते हैं, बहुत अच्छी प्लेस है। तो एक बार जाना वहाँ पे।
Beautiful city and beautiful state.
नो एंड पैलियम इंडिया का वर्क आप देखना।
So if that's then let's wind up the session. So thank you, Dr. Maya, for joining us and for taking the beautiful session on this particular topic. And thank you all others. So stay connected and thank you. Thank you all.
Thank you very much. All the best.
Thank you, ma'am.
Bye-bye.
Thank you, ma'am.
Bye.
Thank you.